So patient is usually not allowed to squat and sit on the ground for few weeks, and patient is not allowed to jump. That is the only precaution which patient is asked to do. However, patient may squat or sit cross-legged in rare circumstances, but he is advised not to do that, considering the fact that whenever he is going to sit down or sit cross-legged, sit on ground, the insert or the implant is going to wear out, in which case the longevity of implant is reduced. Considering this fact, we ask the patient not to sit on ground and not to squat, not to sit cross-legged.